Good morning. I'm Dr. Kunjal Gala, second year resident from Arvind Eye Hospital, Chennai. I'll be presenting a case about a far-sighted view of disc edema. So, disc edema is an ophthalmoscopic finding with unilateral or bilateral swelling of the optic discs, whereas pseudodisc edema is anomalous elevation without the edema in retinal nerve fiber layers. Some of the causes of the same may need extensive investigations, but there are a few which can be as easy a diagnosis as an refractive error. My patient was a 20-year-old female who had presented to us with headache and vomiting since 2 weeks. There was no history of any associated tinnitus, transient visual obscurations, or postural variations, and there was no history of previous episodes. Her vision was 3/60 in both the eyes, improving to 624 with a correction of plus 10 diopters. And her near vision was N12, which was not improving. Her color vision, central fields, pupillary responses were normal, anterior segment was normal. On fundus examination, there was elevation of the disc with blurring of the disc margins. There was no obscuration of the overlying vessels. Her intraocular pressure was 16 and 18 in both the eyes. The patient was then further evaluated for bilateral disc edema. She underwent an MRI, which was normal, and an Humphrey Fields analysis, which was also normal. We then sent her for B scan, and on B scan, her axial length was 16.79 mm in right eye, 16.55 mm in left eye, and there was an increase in the retinochoroidal thickness. It was 1.29 in the right eye and 1.62 in the left eye, with which we came to a diagnosis of both eyes nanophthalmos, leading to pseudodisc edema. So nanophthalmos is a Greek word derived from the Greek word nano, which means dwarf. It's basically a clinical phenotype in which the anterior and the posterior segments of the eye do not develop to their normal sizes, but there is no associated ocular or systemic anomalies. We can have a short axial length, as we saw in our patient, thickened sclera, small cornea, and a shallow anterior chamber. Coming to disc edema, there are 10 signs of disc edema. There are 5 mechanical and vascular signs which help us identify. Mainly the loss of cup, elevation, blurring of the margins associated with vascular signs which are more commonly seen in true disc edema, which can be venous congestion, hemorrhages, and NFL infarcts. The differential diagnosis can be papilledema or can be other causes of bilateral disc edema without a raised ICT. Hypertensive emergencies, diabetic papillopathy. The other causes of pseudodisc edema, as you can see in the first picture, can be a myopic tilted disc. It can be a congenital anomaly of the optic disc, such as in morning glory syndrome, or even very commonly what we see is an optic disc drusen, which will show a characteristic hyperreflectivity on the B scan. Conclusion, any patient with disc edema needs a systematic approach, and we need to make sure that we keep all our differentials in mind and customize investigations which are needed as per as the patient. Thank you.
Thank you, doctor. Was an OCT done?
No.
Right. You have done an ultrasound. OCT also could have given you a clue. Right. Thank you.
The B scan, have you measured the ONST? That also
Give a clue. Okay. Right. Thank you, doctor.